Hello, everybody. My name is Daniel Uribe. I am the CEO and co-founder of GenoBank.io. And today I'd like to speak about BioNFTs as the building blocks for Genomics 3.0. But let's begin with a little bit of my story. In 2017, my son was diagnosed with a rare disease. And obviously, as a parent, I was very concerned, and we took more than 60 sessions in order to get to the topic that we might need a DNA test to get a diagnosis. So we did that, and it turns out that we have a family rare disease that is called Glanzmann thrombocytopenia. It's very similar to hemophilia, but it's not hemophilia. And this is one of the 10,000 recognized rare diseases around the world. It is known, but there is no cure. So that's why these are also called orphan diseases. So orphan diseases or rare diseases affects 77% of world's population. It's more than 560 million people. And 95% of them do not have an FDA-approved treatment. That's the name of orphan. They are orphan in terms of treatment. So in order to participate or in order to help from the family perspective, researchers need our data, needs our DNA. But this is the problem, right? Because this is exactly what the researchers are reporting. There is a shortage of biosamples. There's no enough participation of us as participants, right? But when you get in front of one of these, right? This is a saliva tube that I have in my hands. The problem is that you will always hesitate about many things. And these are just the main ones that are being studied. Is like, who owns and controls my DNA, right? Who has access to it? Is it really going to be for research? I am sure that this is not just another kind of mechanism to just sell my data and just be in the hands of data brokers and no actionable research will be done. And most of all, they're on favorable terms and conditions. Just a couple of days ago, I was reading a consent form from a very famous company. And they, if you sign that consent, you will have them have the right to access your information even after death, right? So not the best, I would say, in order for you to incentivize to participate with them. So this is basically what we are trying to address today, right? In this talk, is that current DNA governance is not really aligned with patients or families in terms of their interest, right? We want to participate. We want others to benefit from the information from us. We want to save lives, to help save lives, right? At the end of the day, we want to be also responsible parents when managing all the information from our kids. But this is the story, right? Since 2012, there's been a lot of unfortunate and cases where people's DNA data has been hacked or be part of different agreements between private companies, governments, and police agencies. One of the most recent, Ancestry DNA, was sold to BlackRock, on $4.7 billion, right? And this was a surprise for the users, right? Because users were not asked before, just because they sign an agreement that the company legally was able to do that, right? And there are big incentives to create DNA data silos that are not necessarily for research or that are aligned with the patient's or participants' interest, right? So here's the good news. The good news is that most of the participants are willing to donate, are willing to participate, if given a detailed consent and control mechanism over their biosamples and biodata, right? This is very, very like obvious, but the truth is that is not happening, right? Not everybody's doing this. So this is the challenge. So this is the opportunity that we are talking today, or what I want to introduce to you is like, I am the author along with William and Triken with what we call the BioNFTs, right? And basically a BioNFTs is that we are using blockchain technology and non-fungible tokens to represent programmable privacy rights or digital rights for biosamples, right? And we represent this using, as we were calling an NFT. And we think with this, we can literally tell the world that biological digital property is possible, right? And as you may know, property is protected by most of the constitutional rights in most countries, right? This is how it looks. Basically, there is a donor, right? In the middle, the white container is supposed to be a biosample, or represents a biosample. It has a QR code, and this is a pre-NFT. So when the donor scans the QR code, it already has the digital signature of whoever wants it, right? Or is requesting for the biosample. And then the donor decides, after reading the conditions, if they want to participate by activating and issuing a BioNFT, which is basically a consent token, right? So the donor will issue a consent token toward the people or the researchers or the entities that they think is aligned with their interest. So in this case, patients or users can control the access to their data and maybe even unlock monetization capabilities, right? Patients can benefit from any of the outcomes there. So this is very exciting, I would say. So basically, this is what we did is a peer-reviewed research. So this is already being validated, because it's not only representing the uniqueness of the DNA data, it's representing the dignity of the people in terms of their human rights. And this is the very core of the BioNFTs. So for us, BioNFTs, yes, they are new biological digital assets for healthcare and genomic research that are decentralized in terms of the governance, because the governance is through the consents, and each biosample has its own personality, right? Its own rights. This is a little bit how it looks. This is a DNA data governance wallet, right? It's not necessarily intended to receive cryptocurrencies, but it is intended to receive or manage crypto digital rights for biosamples, right? This is the thing. And obviously the NFTs framework gives us the opportunity to make them liquid, right? So at the end of the day, sharing data should be a right, should be accessible, and also be protected. Because by using this system, the system also provides, or the protocol also provides protection for both entities, right? It protects researchers against potential data privacy claims, and it protects the donors' right to own their data and right to decide which is a good custodian, right, or a good steward. So why this is important? Well, you might know, or let me tell you, right? Universal newborn sequencing is coming, right? And in some cases, it'll be state mandated, right? So we have to come with a good data governance framework that could solve everybody's needs, all the stakeholders, right? The governments, the researchers, the families, the individuals, the society, right? So as this is coming, and just to give you an example, in March 2021, Dr. Ewan Ashley, using ultra-rapid genome sequencing technique, he was able to sequence the whole genome of a baby in 5 hours. And this was a life-saving maneuver. And this is just because, as I was saying, the same case of my son. They say these are often mystery cases that no one has been able to solve. And we use DNA sequence to try to solve the case. And in most cases, there is actionable items by using the DNA, right? So this is really, really exciting, promising. And finally, as I want to share our vision, this is what we call the Web3 family GenoVault. So it's basically to manage the samples from the baby, from the newborn, in a decentralized way, because in the picture to the right, we see mom and dad authorizing or consenting the access to this or the most sensitive data that we have, right? It's our DNA, but especially our children's DNA, right? It's the future, and we want to be not only good parents as healthcare providers, or to provide healthcare for our children, but also to have proper data management. And we think that this is the future. This is what we do at GenoBank, protect families' interests. And at the end of the day, this is just for them to explore how can genomics help them to take care of their family, right, properly. So this is our conclusion, right? We think we are entering Genomics 3.0, and looks bright, looks really, really promising. But for us, the ideal is obviously based on now clinical applications, right? It's not only for info entertainment, like maybe Ancestry's reports, but these are like 6 topics or 6 main characteristics that in our case should be, right? One is diversity driven, right? Today, it is not. It has to be decentralized in its governance, right? We want to empower families and individuals to own and control their data. It has to be high quality, right? It has to be clinical grade. Has to be affordable, right, in terms of the price that will be a market effect as the demand grows. And the 2 most important for us is that authorities, governments, hopefully will recognize biological property, and hopefully by using a framework similar, or our BioNFTs, right? And the 6th and most important, this is everything is to save lives, right? To save lives of people, save life of the newborns. So thank you very much for listening to this.